Good afternoon, everyone. Welcome to our Pharma Talks session today, focused on a very important topic, immunizations. My name is Karthik Yaga. I'm one of the vice presidents of pharmacy retail operations. I cover the West Coast, and I primarily help customers and our McKesson sales consultants with a lot of the services and solutions that McKesson and HealthMart offers. And I'm really excited today, this afternoon, to be joined by my friend Jitesh Zala. Jitesh, why don't you go ahead and introduce yourself to the group first and tell us a little bit about your pharmacy practice?
Hi there, everyone. My name is Jitesh Zala. I am a pharmacy owner in the Los Angeles area. My wife and I, we have three pharmacies. We were always a standard just drug dispensing pharmacy. Last year, we kind of got into getting into the vaccines and doing something different. So that was our goal last year. It was definitely something that we wanted to try. We didn't know what the success rate would be, but it turned out to be something really good for our store and something that we want to expand on this year.
Awesome. I had the opportunity of visiting Jitesh at the store, and I walked in, and the first thing he says is, I feel bad I'm late to the party. And I'm like, okay, tell me a little more. And I'm, hoping his story will inspire a lot of you and help figure out why immunizations is important to our practice in pharmacy today. So Dishesh, why don't you go ahead and just double click a little bit and tell me what got you inspired, what got you motivated, how did you, overcome some of those initial barriers, and how's immunizations going at your pharmacy today?
So, we were just, like I said, we were just the standard dispensing pharmacy. We thought that, you can still survive just off of dispensing. The reimbursements were okay at the time. But then, as everyone knows, the reimbursements just keep going lower and lower. And it's like, all right, they can't get any lower than this. And somehow they still go lower. So it was like, okay, we need to diversify. What is something that we can diversify on? And we heard about vaccines. We heard about everyone's doing vaccines, and COVID time was a great time for so many people that did do vaccines. Completely missed that boat, but we did join last year. I work in a community in Los Angeles where there's some vaccine skepticism. There's vaccines, you don't need them. I never got them my whole life. The one time I got it, I got sick. A lot of these type of thoughts and concerns from my patients. So naturally, there's still those concerns from those patients. But what we did learn was that there's a larger majority of patients that, you vaccine. Can I get my vaccines right now? Or can I get this, and that taken care of? And it's like, okay, we're not doing it this year, but next year, that's definitely something we'll do on our bucket list. So I was, pleasantly surprised. We probably did maybe about 100 vaccines last year. It's a very small number to cut. Some of these, I'm sure, busier vaccine immunizing type stores, but it was 100 more vaccines that probably would not have happened if we didn't offer it to our patients. So just being another kind of asset to our community, another easier way for patients to get their vaccines. A lot of it's like, how long will it take to get my vaccines? And I said, give me about 10 minutes, I'll get everything taken care of. And it's like, you sure 10 minutes? I was like, yes, 10 minutes. 10 minutes, they're in and out, and then done with 3 vaccines. So, it has been a very successful thing, and something that we definitely want to expand on this upcoming flu season.
That's amazing. Jitesh, why don't you share with us, you just touched on expansion, right? What strategies, what marketing materials, how did you first get in? And then outside of just immunizations and flu, what strategies did you employ in terms of getting the broader vaccine range?
So we started with 3, the bare basic 3, and that was from the McKesson Idea Share last year. We kind of picked the immunizing table here at McKesson, and they said if you're starting for the first time, just start simple, right? Don't go so advanced that you need to have special ways to vaccine. So it's like flu, RSV, and COVID. Those are the 3 that we started with. And, then you realize that, oh, do you do Shingrix? I was like, no, we don't do Shingrix, but that's definitely something that we want to do. And then it's like, do you do this vaccine? It's like, no, we don't do that this year, but definitely something that we want to do next year. So, like I said, it's just us trying to be another asset to our community, something that, they don't want to go to their doctor's office to get it. And if they can just come to our pharmacy, we want to make it easier for them. I'm just thinking, what are different ways? We have our flyers on our pharmacy door, and verbally we tell our patients, but what more can we do to expand on how many patients we vaccinate? So, every conversation that we have with our patients, whether it's phone, we let them know that we can vaccinate. We're going to vaccinate. We're thinking about bag stuffers, A-frames outside of our store, maybe a banner outside of our store. Just different strategies to just get the word out, I think, is what we want to do again.
Yeah, just to plug in here for the marketing edge and some of the marketing resources you have as well on My Health Mart, so definitely leveraging that as well. The two common barriers that I often hear when I walk into a pharmacy is the time that it's going to take to do a vaccination versus filling a prescription, and the training of your staff. And the second one they say is, hey, I have a provider clinic close by or right above my pharmacy. They might get upset. How do you tackle these two barriers? And for the audience, if this is some of their barriers, can you address those for us?
Yeah, so training wise, we have to do the training, right? You have to be a certified immunizer. You have to be able to do CPR. You have to do it, right? There's no way around it. In terms of stepping on toes, right? Definitely a legitimate concern. For us, it was, we would talk to our patients when they come to the pharmacy. Oh, we offer vaccines at our pharmacy. Would you be interested? And it was never, the last year we didn't have a single issue with a provider saying, why did you take my patient's vaccines? That didn't happen. I'm sure it does happen. For us, it didn't happen. But I think providers, this is just my opinion, but providers, I'm sure, would encourage us to offer more vaccines, one less thing that they need to worry about, so they can take care of the clinical diagnosis and all that. But we didn't have a single concern. My other stores, I don't think we've had any concerns at those stores. So I don't think it's a concern, but there might be that provider out there.
Yeah, and I think it's a great point of just having that open dialogue and communication with the providers that you may feel are going to get upset. And you make a great point in today's world where primary care physicians are short staffed themselves. They would rather share their customer base with you as a pharmacist, as a healthcare provider, and focus on the diagnosis of some acute illnesses while you take care of them with immunization. So I think that's a great point. In terms of just staying up to date with your staff, with your pharmacists and all, Jitesh, any recommendations on how best to keep up to date with all the changing requirements and all the new vaccinations, the storage requirements? There's a lot.
Yeah, there is a lot. It's always changing. Updates. We don't know really what the future holds with vaccines, with what's going on, but you have to stay up to date. If there is something that is a change, you have to implement that change. There's a lot of resources available that you could rely on. We definitely utilize the resources. We try to streamline as much as we can. So try to make our life a little bit easier. But yeah, it's you have to follow all the requirements that are required.
Yep, that's perfect. Especially, we heard diversify revenue early on in yesterday and today's conversations we've had. And this is, in my opinion, probably the most basic and simple way to get into taking care of the community while diversifying your revenue and not being just a dispensing pharmacy. So, for the audience, just, really appreciate spending the time with Jitesh and just getting to know that, hey, it's a barrier to get in, but once you get in, you just know that it is another dispensing service, and you can immunize just like you dispense a prescription while diversifying your revenue. Thank you so much for your time, Jitesh. We'll be around if any questions from the audience that you guys want to ask Jitesh. Both of us will be on stage. So you can go ahead, unless any one of you have questions right now, welcome to ask him. All right, we'll be here if you guys have any questions or want to talk to Jitesh about just sharing some best practices on how he went about it. And then there'll be another Pharma Talk session right back in the next 10, 15 minutes, so go ahead and get ready for that for sure. Thank you guys for your time.